Hey everybody, it's Kelly from Physical Therapy here with Guy and Cassie, and we wanted to talk to everyone today about what the rotator cuff is. So I think it's perfect timing because we wanted to do this video anyways, and then given everybody last night talking about Martellus Bennett, the Patriots pickup, because he has a rotator cuff tear and he has a labrum tear, and how is he still playing? But someone you may know can't even lift their arm up to like grab their coffee from the Dunkin' Donuts window, right? So let's start with just the basics. So when someone says my rotator cuff, what are they even talking about? Is that a tendon, a muscle, a bone? So Guy, what's the rotator cuff?
So your rotator cuff are made up of four muscles. You have the supraspinatus, the infraspinatus, the subscapularis, and the teres minor.
Right, excellent. And where are those located? So this is a nice little joint model.
So we have our shoulder model here. So you can kind of see the muscles of the rotator cuff are right underneath this piece called the acromion, which is attached to your shoulder blade. So they're all kind of right underneath this little space, so that when you lift your arm or you use your arm a lot overhead, it's really easy for them to get torn. They're in a very vulnerable position right there.
So those are the tendons of them, and then we'll talk about the kind of the muscles themselves. So when you talk about impinging, and if you get a tear, a lot of times it's where the tendons are because they get squished. Like as you move your arm up, they'll get squished. That's not a big space there. But the muscles of them, so this would be as if you're looking at someone's back. So that's the back of their head. That's your shoulder blade. We call it the scapula. So you have one muscle that sits here. That's the supraspinatus you were talking about.
Yep.
One sits under here, that's the infraspinatus. You have another one called the teres minor, which kind of sits down this way. And then you have one that sits in the front, kind of chest cavity, right on this side of the shoulder blade. That is the one that's the subscap that comes in here. So your rotator cuff is basically, it's a group of muscles. There's four of them. What do those muscles do in terms of like action? Like how can they move the arm or the body? What do they do?
So they assist with abduction, so going out, as well as external rotation, internal rotation.
All right, good. So rotator cuff in general would be really strong in people like pitchers, things
Yep.
like that, where you have a lot of throwing action. So why is it, let's talk about maybe why some people can only do that if they have a rotator cuff tear, and some people can have a rotator cuff tear and have full movement.
Yeah, so if you have a partial tear of the rotator cuff, you might still be able to move your shoulder through that range and lift it up. It might be painful, and you might have other muscles kind of compromising for those torn rotator cuff muscles, and they're kicking in and they're getting a little bit overworked. If you have a full tear of your rotator cuff, that's when it's going to be really difficult to lift that arm or get any type of rotation throughout the shoulder joint.
So the partial tears, that can happen in either the muscle, that can also happen in the actual tendon. So all of our muscles go from like the muscle itself. I don't know if you can see on here. Let's see if we can find a good like example. Maybe right here. I don't know if you can see that, Stacy, but let's talk about like part of your tricep. So you can see the red is the muscle, and then the muscle turns like into this white, which is actually like the tendon, and then the tendon is what attaches to the bone. So you can have a tear kind of in the muscle itself, or maybe it tore right at the tendon, depending how your, I guess, impingement or your accident happened. So how can the rotator cuff tear? Does it have to be a traumatic event, or could it just be kind of, you reaching up for anything?
You can just reach up for something. If let's say you're walking your dog sees a squirrel and tries to run away, if it pulls your shoulder, or just impact.
Yep, so you could do it lifting a heavy table like this, or if you've already got a partial tear and you do something silly and you reach real quick, something like that, you could actually tear it a little bit more. So just going off of Martellus Bennett's injury, he's got a rotator cuff tear, but he also has a labrum tear. So let's talk a little bit about what the labrum is.
So your shoulder joint itself is a ball and socket joint. So you have your humerus, and then you have your the glenoid fossa where that humerus sits in. It's almost like a golf ball on a tee. So the head of the humerus is bigger than that space where it's sitting. So your labrum is like a piece of cartilage that is around the rim of it, and it kind of works to deepen that socket, so it makes that joint a little bit more stable, because your shoulder joint in general is already pretty unstable just because of the shape of that humerus bone.
So when someone has a labrum tear and a rotator cuff tear, the overall integrity of that shoulder joint is not as strong, obviously, as someone that has full strength, no tear, no labral issues. A lot of times if you have a labral tear combined with a rotator cuff tear, depending what you do, they're going to want to fix that surgically. But just because you have a labrum tear or a rotator cuff tear, that doesn't necessarily mean you need surgery. So what are some other things that someone might do if they have a rotator cuff tear or a labrum tear?
So, go ahead, Cassie.
So they can come see a physical therapist, and we can evaluate them and kind of find out where their weakness is and what muscles need to be strengthened. We can help control their pain and use modalities. They might see an orthopedic. They might suggest, a cortisone injection. But physical therapy would be the most conservative approach to kind of control that pain and fix the underlying issues in the shoulder.
Yep. Plasma injections, things like that. A higher level athlete may be getting something like that instead of just going in surgery. Rotator cuff surgery, the recovery process from that can take anywhere from I don't know if you're 6 to 12 weeks, but for the average person, rotator cuff repair, that surgery and that kind of post-op protocol is usually around 10 to 12 weeks before you're back to activities. And if you're doing things like tennis, basketball, football, it might be even further than that. So that's one of the reasons why if someone is playing a professional sport, they may want to put off that surgery as long as possible and just kind of play through it if they're able to. So we talked about the rotator cuff, we talked about the labrum. Did we miss anything? No, I think we got it. All right, if you have any questions, post underneath. If you like this, share it, tag a friend. Thanks for listening, guys.
Thank you.